Your feet might be trying to warn you about something serious right now, and there is a good chance you are ignoring every signal. Here is what most people never hear from their doctors. By the time a blood test catches elevated blood sugar, your body has often been dealing with the problem for months, sometimes years. The damage starts quietly, far from where anyone thinks to look. And the very first place that damage shows up is almost always the same: your feet. The tingling you blamed on sitting too long. The dry, cracked heels you assumed were just seasonal. The strange coldness that never seems to go away. These are not random inconveniences. They are messages. And right now, millions of people are receiving these messages daily and have no idea what they mean. Today, that changes. Welcome to Wellness Secrets. Over the next few minutes, I'm going to walk you through 9 warning signs that appear in your feet when blood sugar has been elevated for too long. For each one, I will explain what most people mistakenly assume is causing it, what is actually happening inside the body, and one simple protective step you can start immediately. Some of these signs are uncomfortable, some are visible, and some are genuinely dangerous if they continue unrecognized. But here is the good news. Once you know what to look for, you can act. You can get answers. You can take control before things progress further. Let us start with why the feet reveal metabolic problems before anything else does. Diabetes does not announce itself with a single dramatic moment. It builds slowly. Blood sugar rises gradually over time, often staying just high enough to cause internal damage, but not high enough to produce obvious symptoms that send someone rushing to a doctor. This is exactly why so many cases go undetected for years. But while you feel relatively normal, your body is already responding, and the response begins at the extremities. Your feet sit at the end of your circulatory system. They are the furthest point from your heart. Blood has to travel the longest distance to reach them, and the longest distance to return. This makes your feet uniquely vulnerable. When blood sugar stays elevated, it damages 2 critical systems. First, it harms the tiny blood vessels responsible for delivering oxygen and nutrients to distant tissues. Second, it damages the delicate nerve fibers that allow you to feel sensations in your feet. Both of these changes happen gradually. Both happen silently. And both produce symptoms in your feet long before they produce symptoms anywhere else. Your feet are essentially an early warning system. The problem is that most people do not recognize the warnings. They explain away the symptoms. They assume the signs are just aging, just fatigue, just dry weather, just shoes that do not fit properly. And by the time they finally get a diagnosis, the damage has been accumulating unchecked for far too long. This is exactly why understanding these 9 signs matters so much. The numbers are genuinely alarming. Health organizations estimate that roughly 1 in 5 people living with diabetes do not know they have it. That represents millions of individuals walking around right now with a condition quietly affecting their nerves, their circulation, their kidneys, their eyes, yes, their feet. Many of these people feel fine. They have energy. They go about their daily lives. They have no reason to suspect anything is wrong. But their feet know. The difference between catching elevated blood sugar early versus catching it late is enormous. When detected early, blood sugar can often be managed through lifestyle adjustments, dietary changes, regular movement, simple monitoring. Many people who catch it early never progress to serious complications. When detected late, the situation becomes far more complex. Nerve damage may already be significant. Blood vessel changes may already be advanced. The window for simple intervention narrows considerably. This is not about creating fear. This is about creating awareness. Because the signs, they have been there. And once you learn to recognize them, you gain something invaluable. You gain time. If you care about protecting your health as you age, subscribe to Wellness Secrets right now. This channel exists to give you the information you need before problems become serious. Now, let us look at the first sign. Sign number 1, persistent tingling or numbness that keeps returning without a clear cause. Almost everyone has experienced their foot falling asleep at some point. You sit in an awkward position, circulation gets temporarily restricted, and when you move, you feel that familiar pins and needles sensation. This is completely normal and resolves within minutes. But there is a version of this sensation that is not normal, and the difference matters. When tingling or numbness in the feet happens repeatedly without any obvious trigger, when it occurs while you are simply lying in bed or sitting comfortably, when it seems to come and go on its own schedule regardless of your position, that pattern requires attention. Here's what is happening inside the body. Your nerves are wrapped in a protective coating that allows electrical signals to travel smoothly from your brain to your extremities and back. Think of this coating like the insulation around electrical wiring. It keeps the signal clean and prevents interference. When blood sugar remains elevated over time, that protective coating begins to erode. The damage happens gradually, so gradually that you do not notice it at first. But as the coating breaks down, the signals traveling through those nerves start to become distorted. Your brain receives scrambled information. Sometimes it interprets this as tingling, sometimes as numbness, sometimes as strange buzzing sensation that seems to have no source. This is called peripheral neuropathy, and research suggests it affects a very large percentage of people with diabetes. In many cases, it is the very first symptom to appear, often showing up months or even years before any other sign. The feet are hit first because the nerves traveling to them are the longest in the body. More length means more surface area for damage to occur. Your protective action here is straightforward but important. Start paying attention to patterns. Keep a simple record of when these sensations occur and what you were doing at the time. If you notice tingling or numbness happening regularly without explanation, this information becomes extremely valuable for any conversation with a healthcare provider. Do not dismiss recurring sensations as nothing. They may be the earliest message your body is capable of sending. Sign number 2, a burning feeling in the soles of your feet, particularly when you are lying down at night. This one tends to disturb people more than the tingling because of when it happens. During the day, there are distractions. You are moving, working, thinking about other things. But at night, when you are trying to rest, when everything else goes quiet, the burning becomes impossible to ignore. People often describe it as heat radiating from the bottom of their feet. Some say it feels like walking on warm pavement that never cools down. Others describe it as a sunburn sensation located deep inside the tissue rather than on the surface. Most people assume this must be fatigue. They were on their feet too long. They wore uncomfortable shoes. They exercised harder than usual. And sometimes those explanations are correct. But when the burning keeps returning, especially at night, especially when the feet are at rest, the cause often lies elsewhere. Here is the mechanism. Damaged nerves do not simply stop working. Sometimes they malfunction in unpredictable ways. Instead of sending accurate information to the brain, they send false signals. Your brain receives a message that something hot is touching your foot, even though the actual temperature around your foot is perfectly normal. The nerves are misfiring. They have become unreliable messengers. Think about a faulty thermostat in a house. The actual temperature in the room might be comfortable, but if the thermostat sensor is broken, it keeps telling the heating system that the room is cold. The system responds to bad information. Your nervous system works the same way. Damaged nerve fibers send heat signals that do not correspond to reality. The sensation is completely real to you, but its source is internal nerve dysfunction rather than external temperature. Clinical research has documented that burning foot sensations frequently appear in the window between normal blood sugar and diagnosed diabetes. For many people, this symptom shows up 1 to 3 years before formal diagnosis. It is one of the earliest and most consistent warning signs. 2 protective actions for this sign. First, elevate your feet for 10 to 15 minutes before bed. This helps reduce any pressure or inflammation in the feet that might worsen nerve symptoms overnight. Second, ensure proper hydration throughout the day. Nerve tissue requires adequate fluid to function properly, and dehydration can intensify neurological symptoms. If the burning persists despite rest and hydration, consider it a signal worth investigating further. Sign number 3. And this is where the situation becomes more serious. Cuts, blisters, or small wounds on the feet that take far too long to heal. Minor injuries to the feet happen to everyone. A blister from new shoes, a small cut from stepping on something, a scrape that you barely noticed at first. Under normal circumstances, these wounds close within days. The body sends healing resources to the site. New tissue forms, and the skin seals itself. But when blood sugar is elevated, this process slows dramatically. Here is why. Your blood carries everything needed for wound repair: oxygen, white blood cells, nutrients, the raw materials for building new tissue. All of these components travel through your blood vessels to reach the injury site. When blood sugar stays high over time, it damages the walls of those blood vessels. They become narrower. They lose flexibility. The smaller vessels, the capillaries, responsible for delivering resources to the finest tissues, are affected first. Your feet contain an enormous network of these tiny vessels. When they become compromised, the delivery system to wounded skin becomes inefficient. The healing materials exist in your bloodstream. They simply cannot arrive at the wound fast enough. The wound remains open longer than it should. It sits there, vulnerable, exposed, waiting for resources that arrive too slowly. Now, here is where this becomes genuinely dangerous. An open wound that does not close is essentially an invitation for infection. Bacteria can enter through broken skin. In a foot that already has compromised circulation and potentially reduced sensation, an infection can progress quickly before it is noticed. This is not a minor inconvenience. Diabetic foot complications represent one of the leading causes of serious medical interventions worldwide. The overwhelming majority of these cases begin with something small: a blister, a cut, a crack in the skin that simply would not heal. Your protective action is direct and non-negotiable. Inspect your feet tonight. After your shower or bath, sit down in good lighting and examine both feet completely. Look at the tops, the bottoms, between each toe or around the heels. If you see any broken skin, any wound at all, clean it properly with soap and water. Apply antiseptic and cover it with a clean bandage. If that wound does not show clear improvement within 48 hours, contact a healthcare provider. Not next week, 48 hours. This timeline matters. Do not assume small wounds will simply resolve on their own. Watch them actively. Sign number 4, visible changes in skin color around your feet and ankles. This sign is right there in plain view. People see it every day, and almost no one connects it to blood sugar. The discoloration can look different depending on the person. Sometimes the skin around the ankles appears darker than surrounding areas. Sometimes there is a reddish or purplish tint. Sometimes the skin looks slightly blue. Especially when the feet are hanging down rather than elevated, most people assume this is sun damage accumulated over decades, or they believe it is simply how their skin has always looked, or they attribute it to a bruise that never quite faded. Here is what is actually happening beneath the surface. Your skin color depends heavily on blood flow. When oxygen-rich blood reaches the skin, it maintains a healthy tone. When that blood flow diminishes, the skin changes color to reflect the oxygen shortage. Your feet are the most distant territory from your heart. Blood has to travel the entire length of your body to reach them. When blood vessels become damaged by prolonged elevated glucose, circulation to the feet suffers first and suffers most. The skin in those areas is not receiving enough fresh, oxygenated blood. It begins to reflect that deficiency visibly when it stops receiving water. It does not die immediately. First, it changes color. It becomes pale, then yellowish, then brown. The color change is a visible symptom of deprivation happening beneath the surface. Your skin operates similarly. Color changes around the feet and ankles are distress signals you can see with your own eyes. They indicate that circulation is struggling to reach those areas adequately. Dermatological research has found that these visible skin changes often appear well before diabetes is formally diagnosed. They are detectable, consistent, and almost universally overlooked during casual observation. Your protective action is simple and takes less than 2 minutes. Every morning, before you stand up, perform gentle foot and ankle movements while still in bed. Rotate your ankles in circles. Point and flex your feet. Wiggle your toes vigorously. This basic movement helps push blood into the lower extremities before you put weight on them and can support healthier circulation throughout the day. Now, I want to pause here for a moment. We have covered 4 signs so far, 4 ways your feet might already be communicating something important about your metabolic health. I want to ask you directly, have you noticed any of these in yourself? Recurring tingling that seems to have no cause, burning sensations at night, a wound that lingered longer than expected, changes in skin color around your ankles. Even one of these deserves attention. If anything I have described sounds familiar, leave a comment below and tell me which sign resonated with you. I read every comment on this channel. This is a conversation, not a lecture. Your experience matters, and your questions help shape future content. And if you are finding this information valuable, take 1 second to hit the like button. That simple action tells the algorithm to share this video with more people who need to hear it. Someone watching because of your like might catch something early that changes their entire health trajectory. We still have 5 more signs to cover. The next several become increasingly serious, and one of them is almost never discussed even in medical settings. Stay with me. Sign number 5. Severely cracked heels that never seem to improve no matter what you try. This one catches people off guard because cracked heels are so incredibly common. Dry skin on the feet affects almost everyone at some point, especially during winter months or in dry climates. Most people treat it with lotion and move on without a second thought. But there is a specific pattern that separates ordinary dry skin from something more concerning. When your heels remain deeply cracked despite consistent moisturizing, when no product seems to make a lasting difference, when the problem persists through every season regardless of humidity levels, the cause may not be external at all. Here is what most people never consider. Your body has an automatic system that regulates moisture in your skin. Sweat glands and oil-producing glands work continuously to keep your skin hydrated from the inside. You never have to think about this process. It just happens. This automatic system is controlled by a specific type of nerve called the autonomic nerve. And these nerves are extremely sensitive to blood sugar damage. When autonomic nerves in the feet become impaired, the sweat glands stop functioning properly. Your feet lose their internal moisture source. The skin dries out from within, and no amount of external lotion addresses the root problem. You are essentially trying to fill a leaking container. The moisture you apply from outside escapes because the internal regulation system has broken down. But the concern extends beyond appearance. Deep cracks in the skin are not just uncomfortable. Each fissure represents a potential entry point for bacteria. In a foot that already has compromised circulation and possibly reduced sensation, what begins as a cracked heel can progress to a serious infection faster than most people realize. Medical literature identifies persistent, treatment-resistant heel cracking as a clinical indicator of autonomic nerve involvement, particularly in individuals with metabolic conditions affecting blood sugar. Your protective action requires consistency. Apply a thick, quality moisturizer to your heels and soles every single night before bed. Focus on the heel and the ball of the foot, but avoid applying moisturizer between the toes. Trapped moisture in those spaces creates an environment where fungal infections thrive. After applying moisturizer, consider wearing clean cotton socks overnight. This helps the product absorb fully while protecting your bedding, and critically, increase your water intake. Your skin needs hydration from inside as much as outside. 8 glasses daily is a reasonable target for most adults. Sign number 6, persistent swelling in the feet and ankles that does not resolve with rest. Occasional foot swelling happens to everyone. Long flights, hot summer days, standing for extended periods, eating a particularly salty meal. These can all cause temporary fluid retention that resolves once conditions change. But when your feet and ankles remain puffy day after day, when you notice deep indentations from your socks every evening, when the swelling seems to have become your new normal, the picture changes significantly. Here's the connection that most people miss entirely. Your kidneys serve as your body's filtration system. Every drop of blood passes through them to be cleaned and balanced. One of their critical jobs is regulating fluid levels throughout your body. Elevated blood sugar, sustained over time, damages the delicate filtering structures inside the kidneys. When those filters become impaired, fluid regulation suffers. Excess fluid accumulates in the body, and gravity pulls it downward to the lowest points. Your feet and ankles become collection sites for fluid that your kidneys can no longer manage properly. There is a simple test you can perform right now. Press your finger firmly into the swollen area near your ankle and hold for 5 seconds. Then release and watch. If an indentation remains visible for several seconds after you remove your finger, that is called pitting edema. It indicates fluid has accumulated in the tissue. This is not something to dismiss as normal aging or simple fatigue. Kidney involvement in blood sugar conditions is extremely common. Health organizations report that a significant percentage of people with diabetes eventually experience some degree of kidney impact, and lower extremity swelling is frequently the first visible symptom that filtration capacity is declining. Your protective actions involve both positioning and diet. Whenever you are resting, elevate your feet above the level of your heart. Even propping them on a pillow while watching television or reading helps encourage accumulated fluid to redistribute. Equally important, reduce sodium in your diet. Out causes your body to retain water, which worsens swelling considerably. Start reading labels on packaged foods. Canned soups, processed meats, frozen meals, and restaurant food often contain far more sodium than most people realize. If the swelling is new, persistent, or worsening, bring it to your doctor's attention promptly. Do not wait for your next scheduled appointment if the pattern concerns you. Sign number 7. Sharp, stabbing, or electric shock pain in the feet that seems to come from nowhere. This is perhaps the most frequently misdiagnosed sign on this entire list. People suffer with it for months, sometimes years, often taking over-the-counter pain relievers daily, completely unaware of what is actually causing their discomfort. The pain can strike suddenly and without warning. People describe it as a needle being pushed into the foot, an electric jolt, or a sharp burning stab that comes and goes unpredictably. It frequently intensifies at night when there are fewer distractions to mask the sensation. Most people assume this must be arthritis developing with age, or an old injury resurfacing, or general joint wear from decades of use. These explanations seem logical. They match what we expect as bodies grow older. But there is another explanation that fits the symptom pattern more precisely. When nerves become damaged from prolonged elevated blood sugar, they do not always simply go quiet. Sometimes they become hyperactive. Instead of failing to send signals, they send too many signals, or they send signals at the wrong times. Your brain receives an urgent pain message, even though nothing is actually happening to your foot. No injury is occurring. No pressure is being applied. The nerve itself has become unreliable, firing alarm signals when no alarm is warranted. Think about a smoke detector with a damaged sensor. It screams at random moments, even when there is no smoke in the building. The alarm is real. Your response is real, but the trigger is completely false. This is precisely what a damaged nerve does. And here's the critical point. Standard pain relievers, like ibuprofen, target inflammation, but there is no inflammation causing this pain. The source is neurological. Taking anti-inflammatory medication for nerve dysfunction is like trying to stop that broken smoke detector by opening windows to clear out smoke that does not exist. The medication masks a signal your body desperately needs you to notice. Clinical research has confirmed that painful diabetic neuropathy affects a substantial percentage of people with blood sugar conditions and ranks among the most commonly misattributed symptoms in adults over 50. Your protective actions involve gentle nerve activation. Every morning before getting out of bed, spend 2 minutes slowly moving your feet. Flex them toward your body, then point them away. Make slow circles with your ankles in both directions. This gentle awakening helps reduce the intensity of random nerve firing throughout the day. Every evening before sleep, give your feet a brief, gentle massage. Light circular pressure along the soles and around the ankles for 3 to 5 minutes can help calm overactive nerve signals and improve your ability to rest. Sign number 8. Feet that feel constantly cold, regardless of temperature or covering. Cold feet are something almost everyone experiences occasionally. Standing on cold floors, exposure to winter weather, sitting in an over-air-conditioned room. These situations produce temporary coldness that resolves once conditions change. But there is a type of cold that does not respond to external warming, and this distinction matters enormously. When your feet remain cold in summer, cold under heavy blankets, cold even when the rest of your body feels perfectly warm, the problem is not environmental, the problem is internal. Here's what is happening inside your circulatory system. Your blood carries heat throughout your body. It functions essentially as your internal heating system. Warm blood pumped from your heart travels through your arteries to every part of your body, including your extremities. When blood vessels become narrow or stiff from sustained glucose damage, warm blood cannot reach your feet efficiently. The volume of heated blood arriving at your toes diminishes. Your feet feel cold because they genuinely are receiving less warmth. Think about a house with a hot water heating system. Pipes carry heated water to radiators in every room. When those pipes narrow from buildup or corrosion, the hot water cannot reach the far rooms effectively. The room at the end of the longest pipe stays cold, even when the furnace is working perfectly. Your circulatory system operates on the same principle. The furnace, your heart, may be functioning fine. The problem is the pipes. Persistently cold feet, independent of surrounding temperature, indicate that blood vessel changes have likely been progressing for some time. This is not typically an early sign. It suggests the process is more advanced. Health research identifies chronic cold extremities as a hallmark symptom of peripheral arterial disease, which has an extremely strong association with blood sugar conditions. Your protective action here is movement. Daily walking, genuine purposeful walking, for 20 to 30 minutes, physically pushes blood into your lower legs and feet. It strengthens blood vessel walls. Over time, consistent walking can actually help reverse some early vessel narrowing. If 30 minutes feels overwhelming, start with whatever you can manage. 10 minutes today is infinitely better than 0 minutes while waiting for motivation. The important thing is to begin and then gradually build consistency. If you have been finding this information valuable, share this video with someone you care about, a family member, a friend, a neighbor over 50, who might benefit from recognizing these signs. You could be providing them with knowledge that catches something early and changes their entire outcome. Sign number 9, and this is the sign that almost nobody talks about: hair loss on the tops of your feet and lower legs. I want you to look down at your feet right now, if you can, or look at them tonight when you remove your socks. Look at the tops of your feet and your lower legs below the knee. Is there visible hair in those areas? Or have those regions become smooth and hairless compared to the rest of your leg? Most people never notice this change. It happens so gradually that it escapes attention entirely. And those who do notice it typically assume the hair simply wore away from wearing socks and shoes every day. Or they figure it is just another sign of getting older. Here is why this matters. Hair follicles are living structures that require constant nourishment to function. They need a steady supply of oxygen-rich blood to produce hair. When that supply diminishes, the follicles do not die immediately. They simply slow down and eventually stop producing. In areas with compromised circulation, hair growth gradually ceases. The follicles go dormant. Over months and years, hair thins and disappears from those regions entirely. The absence of hair on your feet and lower legs is a visible marker of blood vessel damage that has likely been developing for years. It is your body displaying its circulation status right there on the surface, visible to anyone who knows to look. The key word is visible. Unlike tingling or burning or pain, this sign does not require you to feel anything. It is simply there, waiting to be observed. Vascular research has established that hair loss on the lower extremities correlates significantly with peripheral arterial disease and serves as a reliable indicator during clinical examinations. Physicians are specifically trained to look for it. Most patients have no idea it means anything at all. Your protective action is immediate and clear. Examine your lower legs and the tops of your feet closely. Compare the hair density in those areas to your upper legs or your arms. If you notice significant thinning or complete absence where hair should reasonably exist, make getting a blood glucose test your priority this week, not this month. This week, a simple fasting glucose test is inexpensive, widely available, and covered by most insurance plans, including Medicare. The information it provides could be the most valuable health data you receive all year. We have now covered all 9 signs. Let me bring them together clearly. Persistent tingling or numbness without explanation, burning sensations in the soles, especially at night, wounds that heal far too slowly, visible skin discoloration around the ankles, severely cracked heels that resist every treatment, swelling that has become your new unexplained pain that standard medication cannot touch, constant coldness, regardless of temperature, and hair loss on the feet and lower legs that went unnoticed until now. 9 ways your feet may already be communicating critical information about your metabolic health. None of these signs automatically means you have diabetes. Bodies are complex. Symptoms can have multiple causes. But when you notice a pattern, when multiple signs are present, when things that should resolve simply do not, that combination of factors deserves attention. Here's what I want you to do tonight. Before you go to sleep, sit down somewhere with good lighting and take 30 seconds to actually examine your feet. Look at the skin color. Check for any wounds or cracks. Notice the hair distribution. Feel for any unusual sensations. Press near your ankle to check for fluid retention. 30 seconds. That is all. If anything you observe matches what we discussed today, please speak with a healthcare provider soon. Not eventually, soon. This is not about creating anxiety. This is about creating awareness. Because caught early, elevated blood sugar is one of the most manageable conditions in modern medicine. Lifestyle modifications, dietary adjustments, regular monitoring. These interventions work, but they only work when there is awareness that something needs addressing. Your feet have carried you through your entire life. They have walked millions of steps, supporting everything you have ever done. They deserve 30 seconds of attention tonight. I want to be clear about one more thing. Nothing in this video replaces professional medical evaluation. If you have symptoms or concerns, speak with a qualified healthcare provider. Do not adjust any medications based on general information. Get proper testing. If anything discussed today resonates with your experience, if this video helped you understand something new about your body, subscribe to Wellness Secrets right now. We share health information designed to catch problems early and help you stay ahead of conditions that develop silently. Share this video with someone who needs to see it. A parent, a sibling, a friend who has mentioned any of these symptoms without knowing what they might mean. The information you pass along could genuinely change someone's life trajectory. Thank you for watching until the end. Your health is worth protecting. Your feet are worth examining. And the simple act of paying attention could be the most important thing you do this week. Take care of yourself and take care of those feet. I will see you in the next video.